Hi, my name is Pamela Tully, and back in 2020 I was diagnosed with a brain tumour. So as you can probably imagine, absolutely devastating news, something that I wasn't anticipating. We were in the middle of the pandemic, everybody was working from home, myself and my husband, and we had our 1-year-old daughter. I was getting some headaches and I decided to take myself off to the GP, who very thankfully sent me for an MRI, and it showed up. If we fast forward 5 months, I was very quickly brought into Beaumont Hospital and seen by the absolutely incredible Mr. Stephen McNally. And unfortunately mine grew very quickly and it had to come out, so I had no choice. Had to have brain surgery in November of 2020. Thankfully I had a really good recovery, so I had a full resection and it was sent off to pathology, and it was found that I had a grade 2, which is basically got a higher recurrence rate. So for me, being 37, quite young, what I would consider quite young, to have this diagnosis and to be thrust into a world that I had no clue about, had nobody that had ever gone through anything like this. It was just a really tricky time and very unknown and just really hard, if I'm honest. I had my surgery and had, a really good recovery, as in physically. So I had a full resection. They couldn't have asked for any more, really. But I had an awful lot of seizures after the event. And I think, look, for me, not knowing what to expect after the surgery and not really having anybody to speak to and to understand what I was facing, if you will, I had a very long recovery. I didn't really know what to expect. I was 6 months out of work and 6 months ramping back on, because I think if anybody has gone through this, they'll know that it's the after effect and not knowing what to face and the fatigue and how you feel afterwards that I found really difficult. I did reach out to see if I could get some counselling, and unfortunately I was contacted maybe a year and 2 months after my surgery to be offered some counselling, and to me that just wasn't good enough. I needed it very quickly after my surgery because I just found it really hard to cope. Thankfully I was in a position whereby I could actually pay for private counselling, but there's an awful lot of people that are not in that position, and I found it very difficult. I'm, as I said, very thankful that I could do that, but there were an awful lot of people that can't do that. Now, I reached out to Brain Tumour Ireland, the charity, the only charity in Ireland that look after patients and their family, and they were also very helpful. But I think that after such a traumatic life event, there has to be something in place when you walk out of the hospital, regardless of how you walk out, whether or not you've had side effects or you've had seizures like me. There needs to be something in place to help people, because it is a life-changing event, and without those supports, I really feel for people that weren't as lucky as me, that didn't have as good an outcome as I had. There needs to be support in place to help those people for a long time afterwards, because it has a profound and lasting effect on your day-to-day life, regardless of your recovery.